Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society. And today we are joined by Dr. Cheryl Kinney. She's an obstetrician gynecologist in private practice in Dallas, the director of the Center for Female Health and Hormone Disorders, and a recent member of the Board of Trustees of the North American Menopause Society. Thank you for joining us.
Thank you for having me, Dr. Shapiro.
Well, I think most women that are going to be listening to this today are going to be surprised at what we're talking about, because we're talking about something that we traditionally don't talk about and associate with menopause, and that's vocal changes. So speak to me about vocal changes in premenopausal women, midlife, postmenopausal women, and does it have an association with estrogen?
So everything in our voice has an association with estrogen. So I'll answer your last question first. As far as premenopausal women, so during our menstrual cycle, our vocal cords are under the influence of estrogen and progesterone. And during the first part of our menstrual cycle, estrogen helps that environment be very full and supple and keeps the muscles of our voice box or our vocal cords functioning in perfect harmony. Because if they get out of harmony just a little bit, you become hoarse. If one of your vocal cords stops functioning, you completely lose your voice. So estrogen is very important to keep that whole system undulating, like I said, in perfect synchrony. In the second half of our menstrual cycle, progesterone, the hormone, takes over. And basically, the changes in our voice occur because the progesterone makes the mucus much more thick. It causes the muscles to be a little weaker. So women may notice a slight change if they're a singer or a performer or a voiceover artist, that it's harder for them to hold their harmonics and sustain tone. It's more difficult to hit those high notes, and it's much more likely to have the onset of vocal fatigue. So how many women notice this? Very few, unless, again, you really use your voice. The changes after menopause are more profound. So more women notice them, but they often attribute it to something else. Many women think that the deepening of the voice they're experiencing, or the raspiness, or, they cough a little bit more, or their voice seems more dry. They think that's all just age related. But age-related changes are very different than having a lack of estrogen. Age-related changes, you have a more breathy sound to your voice gets more coarse and harsh. That's not a menopausal type change.
Mm-hmm. It's interesting because women sometimes do notice that it's a little bit different, but we usually, don't discuss it in any way, shape, or form in terms of the fact that this is related to estrogen deficiency. So the question then becomes, can voice alone be an indication for us to step in with treatment if we're a woman who really depends on our voice? Particularly, for example, as you point out, the vocal fatigue. It may not be so much the deepening of the voice if you're not a singer or a voiceover person, but if you're using your voice a lot in a professional capacity and having that vocal fatigue, that can be significant, I would think.
Absolutely. And I even treat some of my patients who are school teachers and professors that are up in front of classes all day long for that very reason, for the vocal fatigue. So for women who are in their reproductive part of their life or premenopausal, birth control pills are extremely effective at improving all vocal parameters. Multiple vitamins obviously are important, and we also have some anti-swelling agents we can give them, but monophasic birth control pills, that means they have the same dose of hormone every single day so that you don't get that fluctuation of estrogen and progesterone, but it's very effective at having women maintain their vocal quality. And again, because the change is small for most women that young age, it doesn't bother them. But when you have audiences that can tell if your pitch of your voice is off by 1%, if you're a professional singer, you have to do something about that. And again, if you're a school teacher and by 2 o'clock, you just are getting hoarse in the classroom every day, you need to do something about that. Menopausal women, estrogen, again, not birth control pills, but estrogen itself is very effective at reversing almost all of the changes that we see, the deepening of the voice, the raspiness, the coughing and the dryness. All those things can reverse within a year after starting estrogen therapy. And it can be done very safely. You just have to make sure you're followed closely by your healthcare provider and an ear, nose, and throat doctor.
So it's a fascinating area for women, and to have this link that this is not just aging or not just voice overuse, that it may in fact be estrogen modified or regulated. Is there research in this area?
We had a tremendous amount of research in the 1980s, thanks to two French physicians, Jean Arbital and his wife, Beatrice. Jean was an ear, nose, and throat doctor. His wife was a gynecologist. And collectively, they took care of a group of young singers and noticed these voice changes. So, brilliantly, they took samples of the back of the throat in the vocal cords and the young girls' cervixes, just like a pap smear, and looked at them under a microscope, and they weren't able to tell the difference between the two. So they knew at that point that exactly the same changes were occurring in the voice, so that they felt that the voice would be very sensitive if we gave it estrogen for treatment, and indeed it was. So after that, more research was done. Now, we are very excited to be a part of the Bridge to AI Voice as a Biomarker of Health project. It's led by one of the co-prime investigators, Dr. Ben Susan in Southwest Florida. They're looking at different parameters, particularly Alzheimer's and dementia, because it turns out that you can pick up symptoms way in advance by using the voice and letting artificial intelligence look at that. So what we're hoping is that the same thing will be true for menopause, that we'll be able to more accurately pinpoint the timing of menopause, particularly for young women who may experience menopause not at 51, but at 41 or 42, so that they'll have an opportunity to make family planning or career choices that they may otherwise not have made.
It's so fascinating to think that the voice and estrogen are so uniquely related, and so much information that I think is important for women to know. Thank you so much for joining us today.
Thank you, Dr. Shapiro.